In terms of the presentation this morning, just to give a quick update on where we are in Scotland regarding the context of the programme. I'll talk a little bit about NHS Scotland itself, a bit of context around that, what Scan4Safety means for us as a programme, our driver's vision, what we're trying to do in a kind of timeline that we're trying to do it in. There is a bit of as well I've got around the inventory management system, which for us was one of the fundamental building blocks for the programme right at its very outset. And really the kind of key part really is around what we've started to realise so far by way of benefits, what other parts of the programme we've done, our learning, the challenges that we've had to face or are still facing, and what our focus is going to be for next year. So as Chris said, the slides will come out afterwards. I'm happy to take any questions that anybody has at the end of the presentation. So just to put a little bit of context around NHS Scotland as an entity, for us in Scotland, it's comprised of 14 territorial boards, and you see a map on the right-hand side of that slide. It's not to scale. Some of the island boards have been squeezed in a little bit. Orkney and Shetland are not that close to the mainland. But we are also supported by 7 what we call national boards, who provide a wide range of national services to the rest of these territorial boards around education, the ambulance service, healthcare improvement. And the most interesting one in that list is number 6, our Golden Jubilee National Hospital, which is in essence a waiting times hospital, which is where we are focusing some of our effort as well. Our overall population is roughly in the region of 5.5 million, and we have an annual budget of around 17 billion per year. And in terms of the actual programme itself, for us, Scan4Safety is about collecting that implantable medical device data and linking it to individual patients using barcode technology, which has been obviously covered in previous presentations this morning. A focus for us as a programme is around acute care settings in these territorial boards. We are focusing very much as well on high-risk implantable devices, very much the Class 2B and Class 3 devices. And up until recently we have agreed that our specialties going forward should be the 4 that are listed there in terms of orthopaedics, ophthalmology, cardiology, and interventional radiology. And that's our starting point as we engage with each territorial board. In terms of the drivers and why we're doing this, we split this into 4 areas. First and foremost, we do position this programme as a patient safety programme. Others in previous presentations this morning have mentioned very similar things that I'll talk about later on in terms of Cumberland's reviews and so on. But it is very much from the position from the point of view of patient safety. There is obviously the regulatory element as well in terms of the medical device regulations that are coming in next year. And because of how we've started to deploy the solution, we are also focused very much on stock management and strategic planning and what new data this initiative will result in at the end of it. In terms of our vision statement, I won't read this out line by line, but in essence, we've split it into 3 parts. So as I say, optimising patient safety is the overarching umbrella statement around having that clinical effectiveness and addressing operational efficiency. But we are very mindful of the fact as well, we are about data capture, about how we actually scan devices from manufacture to point of care. One of the key outputs from this programme will be our medical device data hub. And we are also doing work around our medical equipment management systems. And again, that was something that came out the back of the pandemic and in response to how we can make things or improve things in that area as well. This is just very much a graphic of the core data set that we capture around product, patient, practitioner, procedure in place. And as you see right in the very centre there, the key one for us at this point in time is the GTIM. That's what gets scanned in and has been getting scanned in through the pilot sites, and we also have ambitions then to kind of roll out further into other data sets as well. Scotland, I should say, already has some existing national standards as well, so it is very much for us about doing that balancing exercise of understanding whether we replace an existing national standard with any new ones going forward, because they are intertwined across a lot of our national systems that we have in place. So in terms of the timeline, just kind of going back, I mentioned the Cumberland's report back in 2020, and as everyone knows, the COVID pandemic also hit as well. Our medical equipment management system was born out of that as well, I should say, because it was very difficult certainly across Scotland, to understand where things like ventilators were, which is what one of the key components of our medical equipment management system. And in order to kind of try and address that and improve that, the phrase that was used at the time was being pandemic ready for the time the next one comes on, which I'm sure nobody really wants, but we have to be better prepared. And I think that's something that we're now looking to do in terms of that medical equipment reporting and understanding what is available at both a local and national level, and how agile we could be in terms of needing to move that to the areas that need it most. So there were two drivers back in 2020. The Cumberland's report then kind of turned into a conversation, if you like, within the Scottish Government about developing a business case, which was looking at implementing point of care scanning alongside the adoption of standards. But before that, back in 2021, and again, when it came to understanding what stock levels we had, we entered into a national contract with Genesis Automation, and that was about implementing an inventory management system, which I'll come on to in the next slide, across Scotland. And that was, as I say, the building block for us. It's the same supplier that we're using for point of care scanning. And the two key arrows that you see in this diagram here about that inventory management system rollout, which started in 2021 and was completed by March of 2023, that then facilitated the rollout or supported the rollout of point of care from 2002 last year onwards, from 2023. So again, the only other thing I wanted to point out on this slide really was that in 2022, that was really the formal establishment of the NHS Scotland Scan4Safety programme. And that's been rolling out ever since, and it's funded and expected to be completed by the end of March 2026. So in terms of the National Inventory Management System, as I said, that building block that we put in place and completed in March last year, that was all about that integration with our purchase to pay systems, our PCOS system, our catalogue content management system, and also our finance system and e-financials. And this actually really helped us in terms of then rolling out point of care over and above that, first and foremost because it gave our health boards and users within health boards visibility of the same system. This is additional functionality that's getting added on to an existing system, which tends to land quite well when you're rolling out national systems across multiple health boards. In terms of our benefits to date then, so we've rolled out from August last year, we've rolled out into 2 hospitals, into NHS Lothian and Golden Jubilee, which is what the abbreviation is on this slide. And we've kind of tried to start to define what we see as benefits coming through that we can actually measure. So very much from the point of view of when we go into a health board, we put dedicated time aside to doing baseline of 8 benefits that we've identified that we feel every health board should realise as a result of this programme. And the 4 that you can see on this slide around staff time saved, stock maximum stock levels and how we could reduce those, the excess stocks that are being held, and also stock expiry. These are the initial figures that we're starting to see. Now, these are a little bit out of date. I think they're up to May this year, so they've increased a little bit since then as well. And we're now actually looking to roll out further into Lothian as well, into other specialties and into other areas within NHS Lothian. So I would expect these numbers to increase. But from a positioning point of view, we are very keen that the boards themselves own these benefits, that they take responsibility for baselining and then managing them through. They will get supported by the central programme team, but these are the benefits they will realise locally, not that it will be realised centrally. As a programme team, we'll aggregate them so that we can, do a bit of an analysis at the end of the programme to say where did we actually make a difference and how much did we actually save. But it's very keen that at the outset, when we get into the implementation activity within each board level, that the local health boards themselves take responsibility for each of them. And in terms of, so I've covered some of the stuff which I've greyed out slightly at the top of this slide. So I've talked a little bit about IMS and point of care scanning. We also do a lot of work around the 4 Nations engagement, through that, and at least two groups that meet fairly regularly as well. But we've also done some work as well around standards development, about looking at what standards mean for Scotland and how we expect boards to use those going forward. I've touched a little bit on medical equipment management, because that was a bit of an outlier initiative which we've brought in under the remit of Scan4Safety. And what it's resulted in is now that every health board in Scotland uses a medical equipment management system. Most of them are using a system called Equip, albeit on different versions, and one board is using a system called Medusa. But the final part of that initiative is to develop some national reporting, which is being developed as we speak, and hopefully is going to get rolled out and implemented before the end of this calendar year. So that's our hope at this point. We have also developed medical device supplier guidance, which we have on our website, and I've got one of the slides at the end which gives you a link to the website. But again, that was developed back at the outset of the programme in 2022, just to ensure that join up for the full process in terms of making it clear to suppliers what would be expected in terms of GS1 standards. And so a couple of slides then in terms of our learning today and our challenges. So the 4 areas that we've got on here, again, very much linked to local ownership of this initiative about the activity that's underway. Getting that senior executive level support is absolutely crucial. We did learn a little bit of a lesson in one of the health boards where we assumed that the right people at a senior level were aware of the initiative. They weren't. We had to do a little bit of recovery exercise in explaining what the programme was about and what benefit they should get at the end of it. So again, something we're learning as we go, I suppose, in terms of making sure that that doesn't happen again. I've touched a little bit around local resources. We are absolutely clear that we need that local dedicated coordinating or project management role. And then that senior executive sponsorship at a local level as well for local issues. We have had examples in the past where the central team have had to step in just to keep things rolling, to keep things moving to a time scale. And again, it's something we're trying to eliminate at the early on in the programme or early on in the engagement with health boards. And that links as well to the development of a single plan that's owned locally that all parties feed into. That gives a sense of ownership at a local level, and that's crucially important, not just with the implementation, but as I said earlier, also with the management of benefits going forward. And then they really always one at the bottom, that communication activity in terms of how local staff are aware of what's coming in, what's been implemented, what it changes in terms of existing processes, is all needs to be tied up and coordinated very well. And that, again, is something that we're learning as we go into boards and sharing that experience as we start to roll out further. Our challenges, some of which are still relevant for us, local skill levels, our local resource levels and the skills that are there. And what we're finding as we're getting into health boards is that local knowledge is absolutely crucial. So when boards say to us, well, could you give us money and we'll backfill these posts? It's not always the best solution for us because we still need the people who have been working in the boards and local, for example, procurement teams, local finance folks, specialty staff. That's really crucial for us in terms of making this a very quick and easy process to implement. And again, that's not always available as and when we would like. So again, very much a challenge for us going forward. We are in competition with other initiatives for a lot of these resources as well. I am one of about at least 12 national programmes that are being implemented across Scotland just now. And that doesn't take into account any local projects that have been set up by the health boards themselves. So it is very much a case of making sure or trying to ensure that Scan4Safety becomes a top priority for all health boards and that they can devote resources to doing it. We are time bound as a programme. We are funded, we have been provisionally told we'll be funded up until March 2026, which actually isn't that far away now. And we have to make sure that the boards have signed up to their implementation timeframe on that. And that's what we're working with just now. And I have to say as well, although funding, we said will be funded up to March 26, every year I have to bid for money for the programme going forward. And again, I'll have to do that towards the end of this year as well for the final year of the programme. We also have an expectation, I've mentioned in one of my earlier slides, the 4 specialties that are covered. But the expectation is on health boards that once these 4 specialties have rolled out, that they will then pick up the baton and roll Scan4Safety out into other specialties in their health board area. And again, they'll need resources and support to do that. So again, that's something that we need to talk to the health boards about in greater detail. But as part of the implementation, we do tend to say to them, if you want to roll out more, let's have that conversation, because it may well be that we can really help and bring that in under the initial implementation activity as we roll out. So in terms of the focus for next year, the 5 areas that I've got on here. So again, as I've mentioned, we'll continue to work with the health boards to implement that point of care scanning. I've mentioned very briefly the creation of our data hub, which will be one of the fundamental outputs of the programme, and it will enable boards to track devices a lot quicker. And that is something that we've developed as a minimum viable product that should be going live towards the autumn of this year, and we'll roll that out into our pilot areas. So again, that's something that will have to evolve over time, and I'd be hopeful that certainly beyond the programme, we might even be able to kind of provide some access for patients to go in and access their data as well through what the Scottish Government call a digital front door platform. So again, that's conversations that need to happen at a later point in time. We're also doing some work around reporting and analytics and building that framework for stakeholders and existing governance groups to help stakeholders really understand what data will become available and how that should be used. So again, trying to persuade and see where the cases might be made in terms of future benefits going forward, how data can actually help inform strategic planning, how it can actually help inform and look at areas such as unwarranted variation. Again, that's something that we need to pick up in more detail as we go forward before the end of the programme. I've talked a lot about benefits and how we manage those going forward. As a programme team, we'll aggregate those up for each health board as we start to roll out. And we need to make sure that boards continue to press that pedal in terms of making sure that they realise the benefits that is expected, that was initially talked about at the outset of the programme. And part of our programme objective between now and closure is the development of what we call our target operating model. We're very keen, and again, lessons from other national programmes where we need to outline and define in a bit of detail what the world looks like after the programme closes. Where do stakeholders go for any questions? What happens with point of care scanning? How do we make sure it evolves? That all needs to be documented. That all needs to be set up by way before this programme closes. So again, that business as usual environment needs to be in place before the end of March 2026. So that again will be one of the work streams that we'll be taking forward in the next year. And I think that's it in terms of the slides and things I was going to talk about just now. I think the next slide is really that's the QR code for the Scan4Safety website in Scotland. And you see 4 areas in there around. We've got a little bit of information for patients, some for suppliers as well.